Walter Mackenzie was born and raised in Glace Bay, Nova Scotia. Walter started his prolific career journey in Halifax.
He graduated from Dalhousie, but then he went to McGill and trained in surgery, and from there to the Mayo Clinic.
Awarded as a fellowship from the American College of Surgeons in 1938, he looked across Canada to see where he should go, and even then, what he was looking for were opportunities.
Came to Edmonton in 1938, but the war broke out, and he left immediately for the war and rose quickly to the level of a surgeon commander within the Canadian Royal Navy. When he retired, he was heavily decorated with, I think, 4 major medals for his contributions during the war. And he returned to Edmonton in 1945.
Dr. Mackenzie's major contributions as the professor and head and then as the dean were to contribute to have a vision and to contribute to the growth of the faculty, and it was tremendous.
He recognized, I think, excellence, and he relied upon people whom he respected in terms of their ability to choose and select the appropriate people. And he backed them solidly once they were chosen.
And he was able to build the clinical sciences building, which is a 13-story tower, and he built the basic medical sciences building also on that square block campus where the Faculty of Medicine, the University of Alberta Hospital, Walter Mackenzie Centre are located.
I think he had the concept of what an academic health center should be even before an academic health centers were commonly known.
He increased the number of residency programs during his 2 tenures from 4 to 29 residency training programs.
He changed the research within the Faculty of Medicine. He established the Surgical Medical Research Institute, and this rapidly led to attracting good residents, good students who wanted to train here. He was finishing up his deanship at the University of Alberta at the time that Peter Lougheed became the premier of the province, and I think he sowed a lot of the seeds that became the Alberta Heritage Foundation for Medical Research.
He was known as Mr. Academic Surgeon in Canada because of the surgical research opportunities developed. He had a firm belief that research was one of the important pillars, if not one of the foundations in terms of logic and thinking, that all medical students and clinicians should have and should continue to learn in the Osler tradition after they graduated.
So he built up this whole medical center to become preeminent in Canada.
And he was able to carry that concept to international audiences.
He was the first Canadian to become president of the Royal College of Physicians and Surgeons, the American College of Surgeons, and the International College of Surgeons. That's just one reflection of his stature that went way beyond Alberta.
He had been a tremendous international figure for Canadian medicine. And he had done so much, not only for the University of Alberta, but for Canada and the profile of Canadian medicine.
An internationally recognized surgical statesman, superior team builder, and visionary leader. Ladies and gentlemen, Canadian Medical Hall of Fame laureate, Dr. Walter Mackenzie.